Hi, my name is Dr. Marcy Zwelling. I'm an internist in Southern California, and I'd like to talk to you about cholesterol. So, how many times do you talk to your neighbor about what's your cholesterol? Everybody wants to know, what's your cholesterol? What's your cholesterol? It's almost like you're getting the stamp of approval if the number is low. Unfortunately, however, we often ask the wrong question. And I'd like to tell you what the newest, and of course tomorrow this will all change, but at least as of 2012, what the newest ideas are about cholesterol. First of all, what is cholesterol? Cholesterol is a waxy substance. It's very necessary. We must have it. It's very much a part of some of our hormone structure, particularly our steroid hormone structure, sex hormones, etc. So you've got to have cholesterol. It's also a very important part of the cell wall structure. So cholesterol is important. In fact, it helps make your hair look nice. It helps make your skin smooth. It is not one of those bad things. Of course, too much of anything is not such a good idea. The problem with cholesterol is not what it does, but what too much of it does, and what the body does with that extra cholesterol. So let's talk about it for a moment. Milk. Remember those days when the milkman delivered your milk to your house? And he put that milk outside the back door, and when you went to pick it up, there were two layers. There was the fat layer on top, and there was the milk underneath. Why? Because fat and water do not mix. Oil and water do not mix. Cholesterol and water do not mix. So, whoever invented this body, God or whomever in all their wisdom, decided that we needed to have a carrier mechanism for this waxy, oily substance called cholesterol. Those carrier molecules are what you most often hear about when people ask, what is my cholesterol? Let me draw something for you here. So, cholesterol and triglycerides are those fatty substances, are actually contained in a molecule in various degrees. These molecules, depending upon how big they are and their receptors, their calling cards on the outside, bear the name LDL, low density lipoprotein, IDL, intermediate density lipoprotein, VLDL, very low density lipoprotein. All of these molecules, every one of them, has the capacity to deliver cholesterol and triglycerides to the body. IDL and LDL are very short-lived molecules. LDL lives in the system for about 4 days. That's why we all talk about LDL as being the real bad guy. And it's because it sticks around longer. In addition to that, it is the smallest of the molecules. It has the greatest propensity to cause a problem, and it contains mostly cholesterol. So of the combination of products that can be inside the molecule, LDL pretty much contains mostly just cholesterol. Every one of these molecules, and this is important, bears a protein called ApoB. Every one of them has that protein. And that protein is very important. It helps describe, again, it's a calling card for the molecule. What's going to happen to the molecule? How does it hook up with the blood vessel wall? What are the signals that are exchanged? The important thing that I want you to remember is that all of the molecules that carry cholesterol to the blood vessel wall have ApoB. Now there's another cholesterol molecule called HDL. HDL is a little bit different. It actually takes the cholesterol out of the blood vessel wall and carries it back to the liver, or carries it out into the bloodstream, where it will exchange this cholesterol with other molecules. I call them suitcases, because this is a suitcase that carries all of these products in it. HDL, unlike LDL, has a protein called ApoA. It is different. It has a different calling card. Now, I call the HDL a trash truck. It goes and picks up the trash. And trash trucks, as you well know, we've all had trash people by our house. Some of them are much more vigorous than others. Some of them sit in the truck and smoke a cigarette for a long time. And sometimes when that trash truck comes around, it's full. They can't pick up our trash because it's full. We actually now know that sometimes these HDL molecules are constipated. They can't pick up anymore. So regardless of how much you have, regardless of what the number is, and again, this is getting back to that question of what is my cholesterol, sometimes the number is not as relevant as you would think. Now I'd like to make an analogy. Consider, if you will, coins in your pocket. how much money are those coins? Is it more important to have more money? Is it more important to have more coins? This has been a question that we've asked about cholesterol for a long time. The reason for that is because VLDL is a pretty big molecule. It carries a lot of cholesterol. IDL smaller and LDL smaller yet. Well, I'll tell you the conclusion of the study. The conclusions of the study today is that it is more important to know how many of these molecules are running around as opposed to how much cholesterol do they contain. How many molecules do I have is the important question. And as a surrogate for measuring how many molecules, we measure ApoB. ApoB is the number you need to know when you go to your doctor. What is my ApoB? As a matter of fact, the most recent data shows that if we use the old cholesterol numbers, we miss 75% of people who have heart attacks. I mean, let's think about it. We should have this problem off of our plate. We should be able to take care of cholesterol, for crying out loud. Doctors are taking patients' blood all the time. How is it that we haven't controlled this? We've asked the wrong question. The question is not how much cholesterol do my molecules have, but again, the question is how many particles do I have? How many particles do you have? You should have less than 1,000. More than 1,000, you're at risk. There are companies that will actually measure the ApoB. It is a fairly standard thing to get these days. And there are several drugs, we'll talk about those in another lecture, that will decrease that ApoB. So the important question to ask now is not, what is my cholesterol? Show your neighbor that you know what you're talking about. And tomorrow when you call him up, ask him how is his coffee and how many particles does he have running around in his body. Thank you very much.